Good morning and welcome to another edition of Casualty 911 on 88.5 Super FM on this lovely rainy Monday morning. Welcome to all of our listeners, those of you who are regular listeners. We appreciate you. We appreciate the fact that you make it your duty to tune in every Monday morning to listen to various information on various health topics. For those of you joining us for the first time, we welcome you and we hope you have a wonderful stay with us until 11 a.m. Today we have with us, I am by the way, I am your host, Fawn Minviel. Louisa has been here for the past couple of weeks, and joining me today is Miss Cabrina Epifan, who works here at the radio station, and she's always very interested in the various topics. Usually has some questions or some observations that she likes to share. So we are here today this morning. And joining us is a very special guest who has been with us before. We had a wonderful time the last time she was here. Mrs. Cheryl St Cyr, who is representing the dental unit of the Ministry of Health, Wellness, and Nutrition. Today we will be talking about oral health because World Oral Health Day is going to be observed this Friday, the 20th, and there is a special theme. Mrs. Sensi will tell us about it. She will tell us about the plans that are in place for the observance of World Oral Health this year. And our main topic of conversation today will be oral health throughout our lifespan. So, oral health beginning from baby to older adult. We will be looking at some of the common issues at the various stages in life. So, early childhood, teenagers, middle adult, older adult, and we will be looking at some of those issues that are common at each stage. And some of them may overlap, obviously. Some of those issues may happen at any point in our lifetime. I'm sure all of us love to smile. We love to smile, and if we don't take good care of our teeth, then the possibilities are that the smile will not be as wonderful as we would like it to be. So, welcome to Mrs. Cheryl St Cyr. Before we get into our discussion, I would like you to tell us a little bit about yourself.
Okay, I am a dental hygienist from the dental services units. Just 1 minute. I have a little issue there. Just 1 minute.
So, we had some technical difficulties on our end this morning, and apparently Mrs. St Cyr is having some issues on her end, whether technical or otherwise. But she will be right back with us, and we will and we will start off our discussion on oral health. As I said, we will be speaking about oral health at the different stages of life. Sometimes, we take these things for granted. Some of us live to a ripe old age and we have never been to a dentist. We don't know what it's like to be in a dentist office or a dentist chair. So Mrs. St Cyr is back and we will take it from
Thank you
there.
so much. Thank you. I do apologize. Thank you so much.
That's
This is just
okay.
what happens. Okay, I am Cheryl St Cyr. I am a dental hygienist from the Ministry of Health, the Dental Services Unit to be exact. And we will be celebrating World Oral Health Day on Friday. And we are already excited about it. I can tell you we do have a few activities that we want the public to know about. And as you mentioned about, we're very concerned about good oral health throughout the life course as well. Okay, so we were going to discuss that. And I hope that people would ask ask questions, it's good to be able to meet the public and to find out what they want to know so that we can tailor our activities, tailor our treatment plans and stuff according to what the public would like.
Wonderful. So, Mrs. St. Cyr, you have been working as a dental hygienist for how long?
Okay, from since 2015.
Without telling us your age.
I'll just say from 2015, I'm going that way. I'm going that way.
Okay.
But I have been in the dental, how should I say, that dental thing for all my life. From the time I left school, my first job was to be a dental assistant, and I have not left dentistry. It's so wonderful.
Okay, I can see that you have a lot of enthusiasm for your job. You really like
Hmm.
what you do.
Yes, I do.
So that means that you have a wealth of knowledge. There's a lot that you can share with us this morning. So we
Okay.
will start off with taking care of the teeth or the mouth. You know,
Mhm.
when the child is
Right.
born,
Yeah, we can start from
how
there. That's
soon should we actually be concerned about oral health?
okay. As soon as the child has their first tooth, the child need to visit the dentist. But before I go into all of that, I would like to let us know that the theme for this year's World Oral Health Day is a happy mouth is a happy life. So I'm coming right back to what you just asked me. Okay, we're concerned and we're going to be spotlighting from the time the baby has its first teeth to maintaining a healthy smile all the way to when the person is getting older. Okay, so healthy smile even in the older age. As soon as your baby has a tooth, you need to take the child to the dentist. As soon as your baby is born, you have to start taking care of the mouth. You have to clean out the mouth. Because as long as there's a presence of food, and we know milk is the baby's food. So we say, when I say food, that's what I'm meaning, that's what I'm saying. And breast milk can cause problems. So we have to clean the mouth. Take a soft rag. The baby is so sweet and nice. Take a soft rag, wet it, don't make it, not, make sure that it's moist, and just wipe inside of the baby's mouth. Clean the gums, clean the palate. Try and see what you can do with the tongue. You know, you do it gently, yeah? Gently, gently, gently. And you clean the baby's mouth out because you want to get that food out of the baby's mouth. Okay?
Should you be using anything other than just plain water at that
Nothing
time?
else, nothing else, nothing else. So even those of us that don't have the money, we have a little bit of water and a little wet rag, we can clean the baby's mouth. So you do not need that. When the child is 2 years, you can start using toothpaste. Before that, it's not really something that you'd want to put in the child's mouth because they ingest it. Okay, we want them to be able to spit out, and on that age, between that age to 2, they're not able to spit out. We don't want them to ingest any toothpaste at all. And even at age 2, when you give it to them, you know the size of a lentil, that's a pea size. You smear a little bit of toothpaste on the on the toothbrush to brush the child's teeth when the child is 2. Okay.
So, since you mentioned swallowing and you don't want them to swallow it, what are some of the consequences? What might happen if the child tends to swallow
Okay,
every
well, there's
time?
fluoride in the toothpaste. We don't want them to ingest it because a fluoride can be harmful if a lot is ingested. We don't want that at all. Okay, so we're asking for that amount. We're asking for when the child can spit out, and we're saying go ahead and use it. It's all right. Okay, it was made to be used in that quantity for children. It is made to not swallow. It's not food. Although you do get fluoride in um, yellow and dark leafy vegetables and stuff like that, but that is all right because a small amount, trace amounts, and that's all right. But you know how we just overdo things already. Okay, when we have to take a little bit, we feel that we need to take more. More is better. It will get it cleaner and all of these kinds of things. So that's why they discourage using it on a child that is not yet 2 because the child is not able to spit out.
So, we should not be trying to follow what we see in the advertisements where they put toothpaste over the entire
Oh,
brush.
that is right. Because they want you to use also, you can go and buy some more.
Okay. All right. So, thank you for that. Now, in terms of some of the issues that children may have at that age, maybe between having their first teeth and say early childhood and up until maybe 10, 11.
Hmm.
What sort of
Okay.
issues might children have with
All
their
right.
teeth or their oral health?
Okay. So even when the child is a baby, parents tend to feed the baby because they're crying. So they feed them all the time. That's not good enough because they're not going to clean them off all the time. So sometimes when the baby wake up in the night, we know when the baby comes home, the baby is fed on demand. That's normal. That's all right. Baby is fed on demand. But after 4 months, child starts to be weaned off all of that on demand kind of thing. And so you know that parents still continue to feed their children all the time. If they wake up in the night and they're feeling hot, you give them a little bit of breast. If they wake up in the night and they maybe feel a little afraid, they will cry. So you give them some breast. But sometimes the child is not hungry at all. Child is not hungry at all. So we from even then we have to start training our children at that age that they eat. Go to bed. You wake up at a certain time. You fed again, and you know you go to bed. But you try your best to clean the child's mouth because you find that when they do not clean the baby's mouth, even without the presence of teeth, the children end up with problems in their mouth. They have sores, they have that odor, and then their mouth get dry because they get sick and all of these things. So even from that age, you have to start cleaning the child's mouth. You have to be watching what the child eat. Now, if her parents, as I was saying about the feeding the children in the night, that nocturnal feeding, the child wake up at 1, you give them something. Child wake up at 2, you give them something. The child start making teeth, and at 9 months they start having teeth in their mouth, and you keep feeding them all the time in the night or during the day, and especially at night. You know how they like to wake up in the night because I've had two, and they like to wake up in the night and then you have to feed them. You do not clean them off. The little bit of teeth that the children have, they start to decay. So by the time they are 2 years, they're supposed to have 20 teeth. By the time they are 2 years and they have that 20 teeth, every one of these 20 teeth have decay in it. All of
Is
it.
it, is it easy for a parent to notice when maybe the child's teeth have started to decay? Would you notice?
They should notice as to who does and who does I cannot who does not I cannot tell you, but they should because the
So
teeth.
what would you look out for?
Right. You can see the edges are not smooth anymore. Because the little children have the little pearly whites in them of a nice smooth. It's not going to look pearly white anymore. It also have the edges are going to look a little rough. Little by little, you see the rough edges. You see parts of the teeth missing. It's like it's wearing away. Something is happening. It's now a little cream, a little yellow, a little dark. It gets black. You should notice something. But sometimes maybe.
I think we've lost Mrs. Sincere here at the most. Um, she was talking about, how we can recognize when the children's teeth have been the teeth are being affected, where you have the teeth not looking the way they're supposed to. And I was here thinking, but you'd really have to be inspecting those teeth. What do you think, Cabrina? You'd really have to be paying attention to the child's mouth to look out for the rough edges and that sort of thing. So I'm going to try to see what's happening with. Oh, she's back. She's back.
Don't know what's happening, but it is what
We
it
lost you for a little
is.
while. So
Right. Okay.
welcome back to Mrs. St Cyr, and we're going to continue to talk about how to recognize when there's something wrong with the teeth at
Okay.
that early age
Yeah.
in
So
terms
we
of.
were talking about that. You can see little pieces of the teeth is missing. It is not as smooth. It's not as white. You can see there's a hole. There's going to be a lot of discoloration, and that smoothness would have been lost. So you can start. As I said, as soon as the child has one tooth in their mouth, you take the child to the dentist. As I know, it can be sometimes not affordable, but you yourself can check out one tooth. Start observing what's happening. What did that one tooth look like? So when that tooth looks like something else, something is wrong. You know, get accustomed to see what it looks like. What it does it looks like, so that you can, as soon as something goes wrong, you nip it in the bud.
So you mentioned the cost, and that will lead us right into the services that are offered at the wellness centers. And could you
Yeah.
tell us which wellness centers offer dental services,
Okay.
and how can a parent go about getting their
Access.
child to see the dentist, and at
Right.
what cost, if
Okay.
any?
All right. The cost is $5. $5 for any procedure that is done for children. And that is why we make it available for the children. Um, some adults, I would say, do not want to understand why we want to start with the children, but we have to start with our vulnerable group first. See how slow I'm speaking? Vulnerable group first. It's very costly, very, very costly for government to be able to offer dental services. Um, we are trying our best. We want to do everybody. We're not able to do everybody, so we're going to do our best. The services that are available for our children are examination, um, cleaning, that's necessary, extraction when necessary, and fillings. Okay, all these treatments very expensive, but we're doing the best with what we have and what we can give to you. Please appreciate that. Okay. We do offer services to the adults. What we offer to the adults is consultation. In a private practice, you pay a lot of money for consultation, but in the health center, you pay $20 for consultation. You get a prescription, and you would have paid a lot much more money than that at a private office. So you get that done, and you will get an extraction if necessary. You would also get instructions during that consultation, because it's not all teeth that are hurting or all teeth that has a problem that needs to be extracted. We want as much as possible for you to keep your teeth. So you would also get the consultation. You would get chairside instructions as to what is going on with your tooth and what can be done. We may not be able to do it for you at the health center, but we would direct you to where you can get it done. Okay, and an extraction at the health center is $25 for adults, but children, everything we do for them, procedures, is $5.
So if a child were to come in, and while you're examining, you realize that the child needs a filling and they need probably one extraction, would they have to come back, or would that be done on that same visit?
Most likely, because you'd have to prepare for the child. So the child has an appointment for something else. Okay, so sometimes it would have to you would have to get another appointment to come back. Sometimes, depending, you come in for consultation, a child has a tooth that has an abscess, or the child has a tooth that is hurting and it needs the thing it really needs at this time is an extraction. They won't send you home. They will do what they have to do for you. This is an emergency. They will take care of it for you. Okay. But the dentist, as I say, sometimes parents want to say what needs to be done. But we have to do what is necessary for the child. Because the first visit for a child, first time the child coming to a dentist and in pain, you won't want to come and take out a tooth. That's traumatic. So you have to weigh the pros and cons and decide what is best for that child at this time. Sometimes it would mean, even if it is painful, that we have to take it out. But you have to weigh the pros and cons, because you want that child to come back. You don't want to set the stage for a trauma that's going to last a lifetime. So it's a lot. It has a little dynamic to it that sometimes parents do not want to understand. So as I said to you, is what is best.
Okay.
Okay.
I may have if a question in terms of the child,
Mhm.
and as far as feelings are concerned, um, at what age really should a child undergo a filling procedure?
All right. Fillings are there for restoration. That means a tooth has a cavity. It should not remain open there for food to trap in it, for the decay to progress even worse, where the child has an abscess and lots of pain. So there's a cavity, you try and you clean it up, and you restore that to back to what it was as much as possible as to what it was, so the child now can eat, can speak, can move around like normal again. You understand? But some people will tell you, I don't want feelings for the child because the child going to lose that tooth anyway. Now I
Yes.
have to tell you a little bit of God. God was smart when he made the mouth, because you will notice that children will have the front teeth at the top first, you'll have the bottoms. There's a time for it to come into place. Like it's as if the teeth are on a cycle. Okay, so by the time the child is age 2, the child would have received 20 teeth, would be 20 baby teeth. And then after that, the child will lose the bottom ones at the front when they're about 7 or so. It will shake. It will not come out when the child is 1 year. When a child is about 7 or so, there's a time plan. It would shake normally and it would come out. It shakes because the adult tooth is underneath and it is eating away, or I say eating away, I should say absorb. But people I normally say to explain to people say they eat away at the roots of the baby teeth, and the roots of the baby teeth is no longer there, so the tooth has no support. So obviously it will shake, and you yourself take a thread and you take it out for the child. Okay, that's what it's supposed to be naturally. The teeth are supposed to shake and the permanent ones come into play. But sometimes there's decay. When there's decay, when there's a cavity, it needs to be restored. It cannot stay there open. It needs to be restored. However, sometimes when you, as I tell you, what's necessary, there's an age for certain teeth to come into the mouth. If the child is going to lose that tooth in the next few months because we know of the age, we would leave it there and tell you she's going to lose that soon. So we wouldn't really do anything for it. Or they would put a temporary filling on it to cover it, and so that it would just last the few months that it's going to be in the mouth. But there's always a time plan. There's always a science behind what we do. Okay?
Okay, thank you for that. And another, as far as oral health or dental hygiene is concerned, do you think enough is being done in terms of that thrust for public knowledge or even public education?
Okay. I can tell you in we need to do more. We would like to do more. I continue. I wish we could do more. You understand? We are not doing enough. We are prepared to do more. We would like to do more, but are we able to do more? So you see how I explained for you? Is are we able to do more? But we are trying our utmost best to do whatever we have to use it at 100%. We're doing it. Okay? And we do not have a dental in each of the health centers. If we had that,
That's another
I
issue.
even clapping already. If we had a yes, if we had a dental clinic in most of the health centers, especially in the interior, like a place like Saltibus and Mogush, they have children there, but they have access to the dental only via Viewfort. You understand? So it makes it hard for them. So if we could have a dental in each of our health centers, it would really help. But we are not at that level yet.
So that would be a good time to tell us where the services are available.
All right. I can even give you the telephone numbers as well, because I
That would
made
be
sure I said this morning,
wonderful.
let me make sure I have everything in order. So if phone asks me that, I am ready. So yes, we have the Groselet Polyclinic in the north. The telephone number is 468-7636. Okay. Then we have the La Clary Health Center. The number is 468-7934. The Miku Health Center. And I want the Miku people to hear that. Miku, there's a clinic right there for you to come to. Please, please, please. Miku and the environs. That's one. I'm so
So
happy for
tell us
our
the
people.
days as well.
Every day the clinic is
Every day.
open. The
Okay.
clinic is open every day. Okay. Miku is 468-7961. Miku people. Dennery 468-7659. Ancillary 468-7809. Soufre 468-7609. So answer is 78 and Soufre is 7609. Viewfort is 7998. Now, Babono Health Center has been under repairs. It's closed now and partially open, I should say, but the dental is not yet ready as well. But the number used to be, I'm not sure if it's going to be the same number. The number used to be 468-7721. And we've opened a new clinic in Larisus. Larisus number is 468-6954. A mini clinic has been opened in Larisus. We had Dr. Charles working out of the Larisus school some years ago, working and doing health, the oral health work with the children, education, fillings, cleaning, extraction. The public used to come as well. We had a mobile unit right there. And then now they have opened a little clinic right there for the children and for the adults and for anybody who wants to use the service in Larisus. Okay.
Wonderful. So there are quite a few areas where people can access the services.
Mm-hmm.
Quite a few.
Yeah.
So I know that you also do quite a bit of work. The unit also does quite a bit of work. Since you mentioned Larry Shoes at the schools, and I know that sometimes you have camps and so on. So all of that helps in terms of the public education
Mm-hmm.
because you deal directly with the children, teach them how to brush at health fairs and so on. So
Right. Let me just slip something in there.
mhm,
The Rotary Club, Rotary International, has given us a mobile bus. So it's a clinic in a bus that can travel to different areas so that we can see the children. Okay. And we're now in the process of organizing, get a driver to get to the place. Wouldn't that be wonderful for Zenusha?
that would be
Yes.
Let me
wonderful.
tell you,
I'm already looking forward.
let me tell you, I'm so
I hope
excited
they
for
keep
that.
you
Eh?
busy.
Yes, I'm so excited for that because I'm saying, sometimes parents, you have to take time off from work to come with your children because coming to the dentist, you can't send a child by themselves because they are not of age to be seen by themselves. They need to have parents with them to sign the medical history form, to sign the consent form, and to be there because you're doing invasive treatment for your child. But when we work through the schools, the school is more or less like in charge of the child during these hours. The consent form is signed. The parents do not have to come. They do not have to miss work. The parents do not have to take transportation from wherever to wherever to get to a clinic because we come straight to that particular school and we do what we have to do in the school. Now, remember, we have one bus. Eh? I know the expectations are going to be so big. One bus, but we start with one, and we are, we're ready. We're ready to do what we have to do.
Well,
Okay.
I am hoping that since we already have services in certain areas at the wellness centers, so the
Uh-huh.
areas that are probably a little more underserved, where the services are not typically available at the wellness center, they will get priority.
Yes, that's on.
You
As I
mentioned
tell you,
Mongoose and Saltivar, so I hope
yes,
those
yes.
are in the
I'm
mix.
telling you, I tell you, there's always a science behind what we have to do because we did a project 2023 2024 called Brushwell, and we went to all of our schools. I think there's 66 primary schools. We did all the grade ones and the grade K children. We examined their teeth, so we know where the problems are because these children are still at school. So we know where the problems are, and we examined. We took note of the type of cleaning that they need, the gingivitis, the caries or the cavities. We took note of all of that. We have that stats with us. We know. So we are quite aware of where the problems are. And we are going to try. And we are going to try. And we are going to try. Because it's there, the information is there for us to work with and to get to these schools.
It's very interesting. You mentioned gingivitis. Is that an issue that you have come across in at such an early age?
Oh yes, oh yes, oh yes. Gingivitis come because we're not brushing properly. So at that brush well that we did, we taught them how to brush. It's true that some of them don't have the dexterity to do it properly, because we taught them what we call the modified bass technique, which is a circular motion, putting the toothbrush at a 45-degree angle and sweeping in a circular motion, working our way around to the other side and not brushing haphazardly. We told them about that. So we taught them at least the fundamentals of it. You understand? So we hope that they would grow with it, and gradually, as they start to implement it, the little that they can do, it will help. So we expect that when they strengthen adolescents, they have a better structure of what is it they're doing, why they are doing it. Okay, so we put that in place. And we also did a program with the preschoolers. We went into the preschools. We did, how many of them that were? I think 129. We went to all the preschools, all of the preschools, all in everywhere you can think of. We did that. Go to the preschool. We taught them oral hygiene through a story. In the story had about why you brush. We didn't say why you brush, but the story had the person not brushing properly. So we met them at their level. And what we implemented in the preschool, and we had parent teacher meeting online as well. We did a little something with the parents. We taught them that to tell the children when they eat something to rinse them off hot water. Simple. Big people too, anybody can do it. You finish eat something, you don't have your toothbrush, it's not a meal time, you had a snack, rinse your mouth out with water. You rinse your mouth out until you cannot taste what you last ate. So we implemented that in the preschool. We know we have to go back again. This children probably now would probably be going to primary school soon. So it's dynamic. You see how wonderful the dental program is. It's so
Yes, indeed.
exciting.
Okay. So when you do that education and so on, we talk a lot about the cavities and so on. Is there anything that can be done to reduce the possibility of the children getting cavities apart
Okay.
from just brushing? So, say
Okay.
for example, maybe a child comes in late. You said they should have their first visit very early. So the child comes in for the first time at 5 years old. The child comes in and maybe there may be one or two cavities. Is there anything apart from brushing that can be done?
Okay, the cavities come to us, we fix it. We do chest side oral health instructions. That's why we educate both the children and the adults. That's why we educate at parent teacher meeting when we're invited, and sometimes we invite ourselves to. And it's just education. It's just so simple. Eating, making more healthy choices. And look, now we have Ministry of Health, Wellness, and Nutrition. So there'll be I suppose, a more focus on nutrition for all of us. It will help us in many ways, not only with oral health, but in many ways. So it is like teaching our children what to eat. It's like packing the lunch bag with what is needed. It's like telling your child is eat what I give you, not what somebody else give you. It's like telling your child there's no money to give you to buy anything because what you need is in your bag. It's like parents understanding we have a lot of things that children can eat. Golden apple, they don't have to buy the sweet yogurts. You understand? They don't have to buy the grapes because how many grapes you can give a child to full a belly? And it's so expensive. You understand? You want to put grapes. Grapes are not are not grown in St. Lucia. You understand? So there's so many little things, to teach them meal planning for the children. And parents need to know that when children are happy, they already eat. They're not so concerned about eating. And when children are playing, they're not so concerned about eating. So when you pack the lunch bag with a lot of things that are not the best for them and they don't eat it, you you want to beat them because they didn't eat it. It's a good thing that they didn't eat it, because you look at the child is still looking healthy, the skin looks nice and supple, it's shining, the child not looking malnourished, the child is all right. The child is all right. But we want them to eat two yogurts in the morning after they have had breakfast. You give them two yogurts to go to school. Then you give them a packet of what, I don't know the new things they have. They give them a packet of something else to eat. They don't eat the food, they eat the kushoni you give them. But they're sorry for calling it that. Mercy. Sorry, I'm sorry. But they eat the things that, because sometimes when you come and you educate, you feel so sorry when you see their children. You feel sorry when you see them. Sometimes the children are 3 years and they don't have one tooth in their mouth that does not have decay. And you see them with pus. You see them with these little bumps in their mouth. And they in pain. Sometimes you see the children face are so fat. It's big because there's an abscess. It's so big that they have to be hospitalized. Just imagine that this child has been in pain for a few days. The parents are not able to get time off from work to take the child to. It's you feel so sorry when you see them. I can tell you. That's why I'm speaking so passionately. So excuse me for the word I just used there a while ago, there. But sometimes it
So,
does be so.
so the diet would have a very big impact on that. And one of the things is that we realize that a lot of children eat a lot of sugar.
A
And the
lot, a
sugar
lot.
comes in many forms. It comes
Mm-hmm,
in the box drinks. It comes, as you said, in the yogurt. It comes in the other snacks that are given,
mm-hmm.
the cream biscuits and the lollipops and the
Yes.
jellos and all of
Mm-hmm.
those
Yes.
little things that are given as snacks. And usually we don't call fruits and vegetables snacks. So if you're giving a
No.
child a snack, that's what you're giving him. You're giving him
Yeah.
something, a
A packet of this, a packet of
packet
that.
of something.
Yes.
Yeah. And that habit that is built from early childhood, it goes on into adolescence. So
Adulthood. That's
you
right.
have teenagers now. The teenagers at that point, they're a little more self-conscious about how they look.
Mm-hmm.
And then if they have those bad habits and they have not developed good oral health practices, then
Yes.
they find themselves in a situation where, for example, they may have bad breath,
Breath.
their
Mm-hmm.
teeth may not be looking the best, and so on.
Mm-hmm.
They're consuming a lot of high sugar things. The energy drinks are quite
Yes.
popular
Mm-hmm.
among the teenagers. So, what are some of the issues you find among teenagers, or do the teenagers don't really come as much as the children to
Okay.
the clinic?
We do get teenagers because we go in the schools there, but you find that a lot of them have gingivitis. The odor is there. So you find that they already have a little measure of halitosis going on. And when you have that going on for so long, you feel that is how it's supposed to be because you grew up as a young child with that odor, and you get older and that's how it's supposed to be. And sometimes people don't want to tell you that there's an odor in your mouth
Well, that
because
one is definitely a very sensitive topic.
it is so
Somebody, yes,
sensitive.
somebody who
Yes.
has bad breath, it's very difficult for anybody
To tell
to
them
tell
anything
them
at all.
anything. Yes.
Yes. So you see, like, it's a lot of is education. Is education, is education, is education. Trying to change the lifestyle. We have people selling things outside the schools for the children. We still have canteens selling sugar sweetened beverages. We still have all of that. It's just a problem. We just have to do what we have to do, continue and not stop. And that's what we're doing. We're not stopping. We don't have a lot of staff. We're just behaving like we have a lot of staff and we're just doing what we have to do. You understand? Does make sense. You cry over something that is taking such a long time to change. You just have to be at it. At it, at it. We that have to be the change in what we want to see in the world, we have to be the change. That's just what it is. It is what it is. Continue working. That's what we have to do. Now that craving for sugar too. I read somewhere, I just forgot to reference it, that sometimes some pregnant women, excuse me, they have this craving for sweet things during pregnancy. You know, they set the stage for that for the children. They set the stage for that. A craving for sweet. They like it. As soon as you put you make the little baby lick the ice cream, the child like that so much because it's as if they remember that taste. You understand? And they want it. And they say, hey, my child's in ice cream already. And they give the children things that they're not even supposed to eat yet. Imagine a simple thing
And
that a
even
parent.
before the 6 month period is
There
up.
you are. There you are. A lot of them, they give their children things that their stomach is not ready for, and you set the stage for that liking for that. My child don't like carrots. How the child don't like carrots? Child don't, you never give the child carrots. Did you feed yourself carrots when you were pregnant, or you had that high salt diet, that high peppery diet? What did you have when you were pregnant? You understand? So it's like it's from starting from when the child is in the mommy's womb. You have to start the habits. You as a parent eating on time, eating when you're supposed to eat, have a structure. A structure for a child is the best, not only in eating, in everything. But we're going to stay by the eating. I don't that's
Yes, we're
what
going to
yeah,
stay on the
it's
oral
going to stick
health
on the oral
aspect.
level. You understand? So it's the structure you put in a child's life. Oh, it's going to do so much for that child. So as parents, we have a responsibility. That's why our parents need to know. They need to avail themselves, as well as we need to come in, and because we go into the workplaces as well, because there's health fairs that we join with Bureau of Health Education all the time, and to do the health fair so that we can meet people at their workplace, because they can't come out, so we coming in. You understand? We do what we have
And
to
we
do.
get to do the examination or at least some education.
Yes, because we have screening at these places, and we do one-on-one. You get chest side oral health instruction. You get a consultation at your workplace. Nobody else in the room, and you get to talk and say what's troubling you, what it is that I can do to help you out. So we do that as well.
Okay.
You have a question?
Speaking of oral health and me growing up, I remember it has been said or instilled that there were specific toothbrushes that has to be used.
Hmm.
I'm just
Okay,
asking.
So we have the soft, medium, hard.
that's it. It's just a soft.
Somebody, just before you answer, somebody, one of our viewers, Mr. Sheldon Lionel, is also asking about whether we should be using the electric or manual toothbrush. So we're talking about the toothbrush now.
Okay, the manual toothbrush is rotary. It moves in circles. That's all right, as long as you can use it properly. As long as you make sure that you brush every tooth in your mouth, because just like people have patterns of brushing their teeth haphazardly, they do it with the electric toothbrush as well. So you need to brush your teeth in a system. If you're brushing the bottom, brush all of the bottom. You go around the whole shape of the mouth, then you go inside and you go around and get to the other side. So you don't do that, go there, go there. You will miss certain teeth if you do that. So you must have a system. So if you are able to use your electric toothbrush properly, your mind is on what you're doing and you're brushing each tooth, very good. The manual toothbrush, a soft toothbrush. The food is not hard. The bacteria is not big, it's not hard. It does not require the scrubbing brushes that we buy that's hard like anything else. It does not require that. It's because everything is soft, plaque is soft, and you want to remove food off your teeth. So you brush in small circles. You can go online and just said, go to YouTube, how to brush in small circles, how to brush in a circular motion, the best way to brush, and it'll show you, and you will see for yourself how the circular motion does get to all your teeth properly. It gets to the area at the edge of the gum where it can sweep a little bit under the gum and remove plaque and bacteria that is there, and small particles of food that you cannot see if your naked eye is removed. Added to that, we must floss. There's space in between the teeth. Okay, all around the tooth, 360 degrees around the tooth, there's a 3 millimeter depth of gum that your toothbrush can sink into, that your floss can sink into, that food can sink into, that plaque can sink into, that bacteria can sink into and stay there if we don't take it out.
I think the public knowledge is a must as well. And I'm guilty in terms of, for me, if the brush is not firm, I believe that my teeth is not being clean when I'm
Mhm.
brushing. Also, there are persons who substitute, okay, I'm not going to brush my teeth today. I'm just going to use mouthwash. You want to
Mhm.
speak to that?
You have to mechanically get the brush and remove, because plaque is a sticky film, and small particles of food. Remember, I say you can't really see it with our naked eye. The bacteria can see it with our naked eye. It adheres to the plaque because it's sticky. It's as if it's like a magnet. It holds onto it. You will not see it. That's why we say that. I'll tell you that plaque is transparent, but it starts to get that creamy color, that yellow color, that brown color, that yellow color, that black color, the green color. It starts to get all of these colors when it stays there without you taking it out. So every day it stays there, it starts to discolor. Okay. So your shaking water in your mouth would not be able to take away the sticky film of plaque that is on your teeth, that is continue to hold on to food, that's going to continue to hold on to bacteria. It will not be able to do that. So that is why you should not use mouthwash only. And we also need to read the label on our mouthwash. Some of it has so much alcohol in it. Alcohol dries the mouth. When the mouth is dry, you are more prone to get decay. So what you need to do is to brush your teeth until you take out everything. Have a system of brushing your teeth that when you are finished, you rub your tongue across it. You should not feel any fuzzy thing. Nothing should be smooth. If you rub your finger, you should hear a squeak. Like you say, squeaky clean. You should hear a squeak. Yes. So mouthwash alone without brush, not it. Not it at all. You have to use the toothbrush. You have to use the floss. Okay. And you brush your teeth after every meal. Some people brush their teeth as soon as they wake up. That's okay. But after your breakfast, you need to brush it because it's dirty. And before you go to bed, you need to brush it because it's dirty. Now, when you're sleeping, you're not eating any food. So when you wake up in the morning, it is clean. It's true, it's not smelling like the toothpaste. It's true, it's not smelling minty, but you're not a mint tree. I expect to smell like a mint tree. You understand? That's not the natural smell for us from our mouth. The mouth is closed, so obviously, I say it smells of mouth. Yeah, what you said, but we call it morning breath. We call it all sorts of things. But that's our mouth. That's what it is. So after we've eaten, there's food you need to brush.
We have another question
Oh,
related to mouthwash and brushing. So this person is saying that they use the mouthwash before they brush because they have the sense that it loosens the plaque and other whatever stuff is there before brushing.
I know advertising gimmicks, they say a lot of things, eh? But I know is the toothbrush that removes the food off your teeth, the toothbrush that removes the plaque, the sticky plaque off your teeth. I know that. So I know all sorts of toothpaste, even tell you they remove tartar. But tartar is really plaque that has stayed there for weeks and gets so hard that your toothbrush is not able to take it out. So you need to go to the hygienist or the dentist for them to use the special machines or the special hand instruments to remove it for you because it's not going to come out of your toothbrush. The mouth rinses that say that it dissolves tartar. I don't have nothing to prove it. I know what tartar is. I know how it fuses to the teeth like cement. I don't have no scientific evidence to tell you that it will do, so I cannot say that. But as a hygienist, I would want you to use your toothbrush. So I will advocate that you use your toothbrush.
Okay. And I'm going back to the topic of the toothbrush in terms of whether it's soft, medium, or hard. As Cabrina
Mm.
said, she likes a hard because she feels it does a better job. But can it cause any damage
Yes,
when you use the
yes, it
medium
does.
or hard?
Especially if you're not brushing correctly, it wears away the enamel. It causes notches, like it cuts, like a notch in the tooth. And if you continue brushing your teeth like that for years, you end up with a deep notch in your tooth where you have to fill it. You have to put a filling in that deep notch that your toothbrush
Because of
has
your
made
toothbrush?
because of your toothbrush, because you're not brushing correctly and you're using a hard toothbrush. You have cut a notch into your tooth that is so deep that it requires to have a filling in it.
Okay.
Okay, and then you can get sensitivity as well when you're brushing incorrectly, especially with these hard toothbrushes, because you wear away the enamel and the dentine, which is just under the enamel that you see in your mouth, is exposed. And dentine is very sensitive, so you'll feel that you do that sort of thing. Sorry, I'm a little drama person, eh? You'll feel a little,
So
you'll
when
feel
you
a little
use hot
something.
or cold or
Yeah,
spring,
you'll feel
like
something.
it's like a zip.
Yeah. Yes, you'll feel something. Now, also, what can cause that little wearing away of the enamel is sometimes when a pregnant mother vomits. when the pregnant women vomit, the vomit is coming from the stomach, and there's a lot of acid. So the mouth is acidic. So you need to quickly rinse your mouth out with water to remove that acid from your mouth. Not brush your teeth, because if you brush your teeth, because of the constant how should I say, the the acid coming and staying on the teeth, staying on the tongue, it softens the enamel to a certain extent, and then you take your toothbrush and you brush it. So you're adding more friction on it, and then you're wearing the enamel, and you have some sensitivity as well. So we tell people that are pregnant, if they're vomiting, to rinse out with water, brush your teeth an hour later. Okay. You can use a little bit of toothpaste, put it on your finger and rub it on your teeth, because it has fluoride, and fluoride helps the teeth to mineralize. And then you can do that, shake water in your mouth, spit out. You can get a fluoride mouth rinse and soak it up, spit out. But plain water is just as good. Plain water. The same way, like if you have a little problem in your mouth, like gingivitis, and you have had your cleaning by the dentist or the hygienist, they will tell you to soak your mouth with warm salt water. That is to promote healing of the gums. Simple salt water. Eh? That's what your grandmother used to do. Mete cell, glow cell tied. That's it. After an extraction, you wait the next day to soak your mouth with warm salt water. That is also to destroy bacteria, because when we eat, we introduce bacteria to our mouths. So sometimes you have infection after an extraction because you had food in your mouth, you didn't clean it out, but you don't do it the same day. Because you don't want to rinse out the blood clot that is there where you took out at the extraction site. So you don't do that at all. The next day, you soak. I didn't say shake water during the day, or during the day. You just soak it gently. You sluice it with the warm salt water to clean out your mouth and to promote healing of the extraction site.
Okay. Another observation, there were instances where there were certain toothpaste that I use, and again, you of the view that if it has whitening strips, um, it can actually help to get your teeth white. And but then the effects I realize as well, it leaves a very unpleasant feeling in my mouth. My gums would actually be really sore and like very uncomfortable.
Mm.
Uh, I
Yes, harsh. Some of them can be harsh.
I would believe that it is too harsh for my gums or even
Mm.
my teeth as well. Whereas if I substitute to something else with the breath strips, for sure, it
Mm.
works wonders for me.
Mm.
I know, again, we raising up, and every household has been known for Colgate itself, the white Colgate. But for me, I believe the gel, I'm a gel person and not a paste person.
All right, that's your preference. That's your preference. I know there's some toothpaste that you use, especially the ones with the peroxide. Sometimes you
Yeah.
feel like taking out all the skin in your mouth. That's the feeling you feel, like you're removing skin inside of your mouth. Sometimes these things are just a little bit too harsh for us. Using the whitening strips, it it helps. It removes staining, because as we eat with our curries, we drink our wines, we drink our teas, we drink our coffees, there's some margin of, some little staining that we have, and it does help.
Yeah,
Um,
it's a good
but we have to be mindful as to how often we use it, because if it is doing that wonderful job for us, it is stripping away something. Eh? So be mindful as to how we use it. I mean, the toothpaste manufacturers will tell you it's for daily use. For me, I am very careful as to how much use I give it, because if it can do that scouring kind of job, I don't want it to scour away my teeth. So I would not use it frequently. I would use it therapeutically, for a time. Yeah. The same way when you go to the dentist to bleach your teeth, you wouldn't be able to go every 2 weeks, every 3 weeks. Sometimes it has to be every year, or sometimes it have to be every 6 months, because what they're doing for you is really, it's that whitening effect, that bleaching effect can dry up the enamel of your teeth, for
Okay.
want of a better word. Okay, so you very careful as to how often you use it. The saliva has certain enzymes, certain nutrients in it that makes the teeth remineralize. Because when we do this bleaching thing, there's a sensitivity that comes with it. You feel a little sensitivity. Sometimes they give you a little bit of fluoride to go home with so that the teeth would remineralize very quickly. Our saliva does that as well, but it takes a longer time. Okay, so you just have to be careful as to how often we use these things.
Okay, from a professional standpoint, would you recommend having the whitening strips other than going in to have your teeth bleached? What would you recommend?
I would want to go to the dentist to do it done properly.
Okay.
For me, I would want to go to, I know it's very expensive. I would want to do it properly. When you have these strips and you tell the nation, you can use the strip, it's subjective as to how many times they're going to use it. You understand? I don't feel it white enough. I need to do it again. I don't feel it white enough. I do it next week. Or every time I have to go to a party, I doing it. What am I doing? I'm damaging my teeth. So I would not, I on a professional point of view, I know people we always overdo things. So I would not want to advocate it, but it works, it helps, it has its place. But use it the way it is supposed or the way it was prescribed to use it. Okay.
Thank you so
Now,
much.
Mrs. Sensi, our time is quickly going
Eh,
by. You see what I told you? But I really want to touch on oral health in older age. Is
okay.
it, we tend to have this idea that at some point, as we get older, we're going to lose all of our teeth anyway. Is
Yeah, yeah, that is true. That is true. But even at that time, I'm saying that to our seniors, you want to enjoy the food that you love. So you need food. You need your teeth. If you need food, you need your teeth. Your teeth are used there for you to eat your food. You understand? You have to also be aware that sometimes medications can dry. There's certain medication that our seniors have to take, and it can cause something called xerostomia. It dries the mouth. You have to be mindful of that because it causes cavities. But you want to keep your teeth. You want
so
to
what
speak
can be
properly.
done? What can be done to try to keep the teeth? I mean, even at an older
Of your
age,
age.
just
The
natural that
same
we will lose
instructions,
them.
the same instructions that have been given from the beginning of your lifetime, the same instructions are there for you at towards the end. And if you had been adhering to the instructions from since whenever, you should be doing very well when you're in your older age. You'll be conscious of it. You understand? Our older ones, they say they tend to have gingivitis. They don't really have decay problem. Um, like my grandmother, your grandmother, but they will have problems if they gums because they do not know about flossing. They never knew about brushing in a circular motion. So you find a lot of food particles have stayed just beneath the gum surface and started more bacteria getting down underneath the gum and absorbing the bone that holds the tooth in place. You find they have this teeth shaking and they lose a lot of teeth via from going from gingivitis, going to advanced gingivitis, and going to another disease called periodontitis, where you find that the absorption of the bone takes place. So, but it has to do with their understanding. You visit your dentist, visit the dentist. We will help you with getting it under control. Because even then, when you have this shaking, this teeth shaking in your mouth, we can stop it from happening in other parts of your mouth. Sometimes you have no choice but to lose the tooth because it is shaking so much. Sometimes we can extend the life of the teeth by doing a cleaning and teaching you how to take care of it, showing you how to appreciate it, what to do, what not to do. Understand? So our seniors, you need your teeth. Imagine a healthy smile makes life better. Oh yes. And you see our elderly people smiling and you see when you see they come to the clinic, they're looking good. I just love that. I love that. So it is important for them to take care of their teeth. The same instructions. The instruction brush twice daily every day at least for 2 minutes. Floss at least once a day. Rinse out your mouth with water when you don't have your toothbrush with you. You rinse your mouth with water. Make good food choices and visit your dentist. You understand? That's what it
We
is.
have one comment here. I don't know if you want to touch on it.
Me hear you.
Saying dental care is very costly. So
Very
if
much
dental
so.
care is very costly, I guess he's talking about, is it really accessible? Can the people who really need it get it?
Okay. All I can say, it is available, and we're doing the best that we can with the limited resources that we have. But the staff is there. We're working. We're doing what we have to do. But home care, you see, home care, understanding that you have a responsibility for your own home care, you will cut down on the amount of money you would spend on your mouth. You'd cut down on it. I know it's not an easy thing to do. I'm not just saying that because we have worked with people, because it's just not something that is commonplace to take care of your teeth. You understand? So we continue to work, we continue to talk, we continue to give advice, but we're telling you, brush twice daily after meals. Make sure you brush your teeth after you've eaten in the night before you go to bed. Flossing. Flossing. Make sure you floss. The floss is just five something at SNS. Little thing. Just buy it. It can last you a month. Brush your teeth, rinse your mouth out with water. So you do the home care. So whatever we teach you, whatever we do for you at the clinics, you augment it with the home care.
Absolutely. Very well said, Mrs. Sincere. Thank you for joining us. Before we go, if there are any activities planned for World Oral Health Day, I would like you to share with
All
us.
right. So at the Grossnet Polyclinic, I can tell you we actually going to do a program with the diabetic and hypertensive patients. So they will be doing a series of education up there on Friday. There's a beautiful activity. So if that's where you fall in, you can go up there and you are going to understand how to take care of your teeth. You're going to understand that your systemic diseases, how it can affect your oral health, because as I said, the diabetics, I said that before, long ago, not right now, but before, that the people who are diabetic, sometimes those who have these high blood sugars, even when they take the medication, after they do a cleaning, because of the bacterial load that they have in their mouth, it prevents the the medication from working effectively. So we want our diabetics to know these things. So we have that going on at the polyclinic. At Leclerc, they are going to be doing a workshop with the pregnant mothers in that area. So if any of them from Leclerc hearing, at the VBCC auditorium just next to the Leclerc Health Center, there's something in the morning where they're going to be doing a workshop with the pregnant, because we have invited some of the pregnant mothers from the area to come. Anybody else can come as well. So Miko is dealing with a preschool. So they're going into a preschool, and they're going to spend some time with these preschoolers, and they're going to educate them. They're going to have fun, because they also have a craft and everything for them. So that is in order. So we have Denry. Denry is doing the same with the people that are coming to the clinics on that day, on Friday, because Friday is Dr. Day. So we expect that they're going to have a lot of people there. So Denry is also going to be speaking to the general populace as well in Denry, and educating them. All questions are going to be asked. Gifts will be given so they can come. Okay, there will be fruit baskets and fruit bowls given so they can come. Ancillary is also doing something at the clinic, but in the afternoon they're going into the community. So the community of ancillary come out because they want to do something like street vibes with them, asking you what you think about certain things, and getting your answers. And we want to put that on the air so that people will see. So come out, the people in ancillary. And Soufre is going to a secondary school. They're going to be dealing with adolescents. Then they're going to be speaking to them as well, gifts involved and everything. So they will be at the school in Soufre, the Soufre Secondary School, I think it is. But they're going to be at
Yes.
a school in Soufre. And Viewfort is also going to go to Comfort Bay. They're dealing with the elderly. So you see, we have it all around. So they're
The
going to be
full
dealing with
lifespan.
that is right. They're going to be at Comfort Bay doing treatment for our elderlies that are right there. Okay. And then, so we have more or less taken the whole life course. We have seen to the whole life course. And we don't have much staff, but you can see we're doing the best that we can. Okay, so we put something in place so that we can take um be able to meet everybody's needs, the population, a cross section of the population, that is, I should say. I just excited, not my fault.
Sincere, I think
Yes.
your I think your contribution was very, very informative, and as always, you give it in a very engaging way. It seems like our viewer does not want to let you leave this morning. There's another question for you.
Okay, that's no problem. That's no
How
problem.
damaging is smoking to dental health?
Oh, smoking dries the mouth. Smoking causes cancer, make you more prone to oral cancer, deadly disease. It stains the teeth, makes it unsightly. Smoking gives the mouth a very terrible, horrible odor. Okay, and you see the staining, so unsightly. You see the smoke, it I'm not even going in the lungs, I'm staying in the mouth alone. It's just not good. It is so damaging. It's just not good. It's don't smoke. That's what I have to say. Do not smoke.
Okay. And I think I missed out on one question earlier. I will ask you now. Is it the sugary foods or inadequate cleaning that causes the problem of decay?
It's a combination of both. A combination of both. Okay, so we still, whatever we eat, we still have to remove it off our teeth, of our tongues. We have to remove it because there's the presence of bacteria in our mouth. We bathe, there's going to be bacteria. You bathe again, it comes back. It's going to multiply as long as the dirt start to accumulate on your skin and the sweat, the moisture, it will multiply. The same thing in the mouth. There's food there. You will not be able to take out all the bacteria after you brush your teeth. Some will remain there. You make the place just right for it. It's warm, there's moisture, and there's food. So it's going to multiply. Yes. And then you'll have from that multiplication happening as it feeds on the food that is left there, a chemical reaction takes place where an acid is formed. That acid now causes pits on the enamel of the teeth, and that's where the cavity starts to begin.
Okay.
So it's a combination.
Okay. Thank you so much, Mrs. Sensei. It was a pleasure having you with us this morning.
It
So
was a
very
pleasure. It was a
engaging, so
pleasure
very
for me.
informative. I don't know if Cabrina has any more questions or any comment that you'd like to make before we
It was
close
very
it down.
insightful for me.
All right. Thank you. Thank you for having me. Everybody who called, thank you. Those who are listening, I am so happy that you listened this morning. Thank you. Thank you for having me. You can ask me to come anytime.
And I will take you up on that offer most definitely. So we're wishing you a wonderful day.
Thank
Enjoy the
you.
rest, and thanks again for being
Thank you so
here.
much. All right.